Hello, my name is Kimini Contreras. I'm a student physical therapist assistant at CBD College, and this is my week 6 video submission for PTA 600. So today we'll be discussing a case about a 25-year-old male who is in an inpatient rehabilitation facility after undergoing a motor vehicle accident. From this accident, he sustained a right shoulder disarticulation and a traumatic brain injury with cognitive deficits and postural control. A traumatic brain injury is caused by an external insult to the brain. It is not degenerative or congenital by nature, but the severity of the injury can cause impairment of cognitive or physical functioning. Typically, when acceleration and deceleration forces cause a traumatic brain injury, it results in a coupe-contra-coupe injury due to the bouncing motion that the brain experiences. At the scene of the accident, the patient was found apneic or in a status without respiration, a systole where the heart is not pumping, and he also had fixed pupils. He sustained an anoxic brain injury after being unconscious for more than a minute. Anoxia, or deprivation of oxygen to the brain, is a primary brain injury that can cause neuron death if it lasts longer than 3 minutes. So now we will be discussing some contextual factors such as personal, environmental, and socioeconomic. So some contextual factors regarding this patient is that he has a medical history of depression, anxiety, and drug addiction. Currently, he lives with his mother in a single-level private home with 12 steps and a left handrail to enter. Prior to the accident, he was independent with mobility to all activities of daily living, including his full-time employment as a mechanic. I believe his history of depression, anxiety, and drug addiction need to be considered when treating him because many people who experience an amputation experience grief, and he can undergo depression even more so considering the loss of his limb and his new lifestyle. A recommendation that I would make to optimize the patient's safety and accessibility in his home and work or community environment is that before discharging him, I would educate him and his mother about home safety and fall precautions, especially when taking a shower or going up the stairs. It is important to make sure the patient has a clear path to prevent tripping over furniture or items in the house. It is also important to do gait training up the stairs to make sure the patient utilizes his surroundings towards his benefit. We want to encourage independence, but also safety. So I would also recommend including an occupational therapist to ensure that his inpatient to outpatient transition is encouraging and efficient. And I also found a community that could help this patient during his transition. There are numerous community resources that could serve as a great support system for this patient. One organization that I would recommend is the Amputee Coalition because they have a variety of programs such as peer support groups, pain management information, mental health and wellness information, workforce development programs, advocacy programs, and so much more. Reaching out to an organization like this can help the patient navigate through their new life without having to do it alone. This could be very encouraging and may have a positive impact in his recovery process.